Hi, this is Lauren Rayfield here for Nurse Practitioner Roles in Primary Care with Dr. Janelle Harding at Fort Hays State University. My project today is over nurse practitioner admitting privileges. During this presentation, we will review hospital privileges and nurse practitioners today. Should nurse practitioners choose to seek hospital privileges? Who currently has privileges? What the application process for privileges looks like? And what the future of privileges and nurse practitioners might be. When we talk about hospital privileges and the nurse practitioner, it's important to answer two questions. What does it mean to have privileges? And are privileges required for a nurse practitioner? To answer the first question, we'll look at what the definition of admitting privileges is. Essentially, you've entered into an agreement with a facility that allows you to directly admit your patient for care, bypassing the emergency room. Once your patient is admitted, you are then the contact person for all medical needs and treatment plans. So you write the orders, you round on your patient every day, you determine if they're ready for discharge. Some facilities may have what are called levels of privilege. And they have different reasons for this, but if you have full privileges at a facility, that means that you can admit and discharge, view patient records, write orders, order treatment plans. If you have anything less than full privileges, that is sometimes referred to as associate or affiliate privileges. And the reason that hospitals may grant you a truncated privilege has to do with patient confidentiality. If you don't have full privileges, they may not want you to participate fully in the care of your patient for one reason or another. These would be agreements that you enter into with the hospital, and it'll be important that you look at that contract to understand what you can and cannot do. You may be able to round on your patient and view the patient records, but not write orders, or you may be able to write orders but not do any bedside treatment. Like if they have a boil that needs lanced, if you may not have the privileges to do that procedure at the hospital, even if it's something that you could do in your clinic. So it will always be important to look at what you can and cannot do under the privileges that you will be provided. So, are privileges even required for nurse practitioners? Well, according to our book, admitting privileges are not required to practice as a nurse practitioner if you have previously made an agreement with a hospitalist or a physician who does have admitting privileges. In that situation, if you have a patient that comes to you and you determine that they need to be admitted to the hospital for one reason or another, you would transfer care to that hospitalist or that physician that you have an agreement with, and they would be the contact person for all medical needs during that hospitalization stage for your patient. After discharge, you then would resume care for your patient. Not having admitting privileges does not mean that you can't round on a patient that you have determined needs to be hospitalized. So, if you do have a patient or two in the hospital, nothing is stopping you from coming in to see that patient, but then you just have to be aware I probably won't be able to look at their chart, but maybe I can talk to my partner to get an update on how things are going and give maybe some background knowledge for what is currently going on with the patient. If you do choose not to seek hospital privileges, there's a number of ways that your patients can be seen in the hospital. So, this prearranged partnership, or you can use hospitalists in the facility in your area if your facility has hospitalists. So, this would be making a phone call, contacting the hospitalist that's on, telling them about your patient, and that hospitalist will have to agree to take your patient, and that way you could directly admit your patient as well. So, what is the benefit of using a hospitalist over choosing to see your patients, have privileges, round on them while they're in the hospital? There are a few advantages to a hospitalist. Most facilities would have an in house provider 24/7, so your patient would have access to a medical provider any time of day or night. Hospitalists are specialized to acute care patients because that's who they see each and every day. They're more accessible to the nursing and ancillary staff, which means timely care for your patient. However, not all medical decisions may be in line with your practice style. So if you turn your patient over to a hospitalist, they may choose to treat situations slightly differently than you would. So you're kind of giving up some of that practice control. Conversely, if you choose to have privileges and round on your patients, you'd have to round before or after clinic, or maybe over your lunch break if your clinic is close to the hospital. You may find that you're not as comfortable caring for acute disease processes because you tend to work on the preventative side, and there may be complications associated with the acute disease process that you haven't seen very often. You may not be as accessible to staff caring for the patient in the hospital. If you're in the middle of clinic and they have a question or they want to clarify an order, they'll have to wait for you to be available to call back to the facility and clarify, write a new order, cancel orders. However, that continuity of care, you will bring that personal relationship that you have with your patients and be able to guide the care because you're the one providing it. So there's some pros and cons between using a hospitalist and choosing to round on your patients yourself. Additionally, you can look at some of these reasons for whether or not you should seek hospital privileges. And there are a lot of good reasons for, and you might view them as good reasons against it. And then I listed some neutral ones that are kind of out of our control. So, pros for seeking hospital privileges: that continuity of care from clinic to bedside. If you practice in a rural area, then you can truly provide comprehensive care. So, if you are in an area where access to healthcare is low already, being able to directly admit and then round on your patients in the hospital would be a benefit to not only you to take care of your patient, but also to the community at large. Additionally, this helps you to function as an independent provider and supports professional advancement. According to the book, there's a lot of pushback from physicians stating we shouldn't be able to practice independently if we don't have admitting privileges. So this would be, kind of a check mark in the box saying, well, actually, I do have admitting privileges. I can practice independently. Some cons to seeking hospital privileges: not all health plans consider a nurse practitioner a PCP at this point. Again, acute care knowledge may not be as strong if it's not something that we work with all the time. And there could be some increased time with little monetary return. That speaks to the time it will take you to drive to and from the facility, the time it takes away from the patients that you see in your clinic, and depending on kind of how you can bill, it may be more advantageous to see more people in the clinic per day than it is to see one or two people in the hospital and shorten that clinic patient viewing window. And then some of the neutral things to consider: some of the health plans will just require you as a primary care provider to have privileges. So it may be kind of out of your control. The local facility may not have hospitalists, so it may not be an option for you to turn over care to the hospitalist for your patient that needs to be hospitalized. And your local facility may not be offering privileges to nurse practitioners. So that would be why I can't seek privileges, because my area hospital doesn't offer them to nurse practitioners. So, who currently has hospital privileges? To answer this question, I pulled up, I believe it's called a statute of condition of participation, 42 CFR, and then the standard for care of patients. It's in accordance with the hospital policy. A governing body must ensure that the following requirements are met. So, every Medicare patient is under the care of a doctor of medicine or osteopathy, as long as they are licensed in the state they're providing care. But there also is a provision that contains language that allows for delegation to other qualified healthcare personnel within the state's individual laws. And this is where a nurse practitioner may fall. as this other qualified healthcare personnel to provide inpatient services to patients under this umbrella here. A doctor of dental surgery or dental medicine, they must be credentialed and practicing within scope. A doctor of podiatric medicine, a podiatrist, also must be practicing within the scope and authorized by the state. A doctor of optometry, a chiropractor, they must be practicing within the scope, and the scope of treatment only includes manual manipulation of the spine to correct a subluxation demonstrated by x-ray. And then finally, a clinical psychologist. And their scope of treatment only includes services that's defined in that statute that there's a link to there. So a lot of different providers currently have privileges, but some of them, of course, are very narrow. And then in the case of a doctor of medicine or osteopathy, of their scope is very broad when it comes to hospital privileges and activities. So what's the application for privileges look like? First, you apply. That seems pretty straightforward. You provide the facility specific application. You will need to include your resume with previous work history and education as well. A medical staff committee at that facility will review your application and supporting documentation. They're specifically going to be looking for competency and experience, professionalism, any patient care experience or knowledge that they have about how you specifically provide patient care. And additionally, they may need a recommendation from a medical staff member at that facility. And then, if you do get accepted for privileges, you'll want to work with the facility to ensure you're a covered provider for the more commonly used health insurance companies at that facility, and expect to go through a renewal process every 2 years. And that is set forth by the Joint Commission, that renewal every 2 years. So, what does the future for nurse practitioners look like? Job growth for nurse practitioners is projected to grow around 26% through 2028. There's expected to be a physician shortage through 2032. So, nurse practitioners are going to be able to partially address this lack of physicians by the increasing number of nurse practitioners joining the workforce during the same time frame. It's not going to completely fill a void, but that's one kind of expected role for the nurse practitioner, is to continue to be the stopgap between physicians providing primary care and mid-levels such as nurse practitioners and PAs. Additionally, hospitals are undergoing many changes in the delivery of healthcare, including mergers and closings. So, to maintain viability in a changing healthcare landscape, hospitals should really be looking for admissions from a variety of sources, which will include nurse practitioners operating as primary care providers. Additionally, there are many roles that a nurse practitioner can play within the healthcare system, and part of that will go towards advocating for increased privileges, increased privilege level. So if hospitals are only giving partial privileges, bumping that up to full privileges, really taking a close look at the committees that decide who gets privileges and making sure that they are considering nurse practitioners as that primary care function, and pushing for an honest review based on competency and not maybe like a buddy system or who you know versus what you know. So kind of being that impartial, let's make sure we're putting the best people forward within the scope and the state laws. Let's bring in these nurse practitioners to help fill the voids of lack of primary care providers as well as decreased admissions. How can we bring patients to the hospital appropriately who need them? And nurse practitioners can help with that as well. So overall, I think the future for nurse practitioners is bright. Not only can we function as primary care providers, but in those other roles as well to help advocate for expanded scope, whether it be on a state by state basis or in states that have full practice authority, getting those nurse practitioners into roles and situations that maybe they haven't been previously considered for in the past. These are my references that I used for my presentation. Thank you very much for watching and have a great day.